And I just wanted to start today by recognizing that those of us attending from the Kingston area are situated on the traditional Anishinaabe and Haudenosaunee territories. It's hard to believe it's the third day of spring already, but I just want to give thanks to these lands and all the little signs of spring I've been noticing on the way to work. And I also want to give thanks for this time over the next hour to reflect on stigma and mental health and how our work as researchers can help support health systems that are equitable and accessible. And I'm really pleased that Brooke agreed to talk to us today, and I'm happy to introduce Brooke. She's a research scientist at HSPRI and an Adjunct Research Assistant Professor in the Department of Biomedical and Molecular Sciences. And her research focuses on mental health, stigma, and stress in individuals at the post-secondary and emerging adult phase of the lifespan. And I know that as I was looking her up today, I already knew many things, but she's presented on a number of panels on student mental health during COVID. So we're really excited to hear her talk today on Canadian Student Mental Health Network. So over to you, Brooke. Thanks very much.
Thank you. Sherry, am I set up to screen share? Let's find out. Yes, looks like I am. Good.
So if people have questions in the chat, I will be moderating, so we'll have time after, but please use the chat. It's a great way to converse, and I'll make sure that I keep track of those.
Great. So thank you everybody for having me. I'm excited to talk to you today about our most recent initiative in my lab. I also have with me today 4 incredible students who have been hugely involved in developing this initiative, and so they're here with us today. So the format of what's going to happen is I'm going to talk at you for a brief amount of time and just give you a little background on me and the sort of what I've done so far in my career and how I got to the development of the network. And then I will take you on a little walkthrough of the network itself, show you a little bit of what we've done over the last year or so. And then I'm going to open it up to those 4 students, Maddie, Amy, Breanna, and Anjana, and they are going to tell you a little bit about themselves and their sort of role in what they've done with the network so far and what they think about the initiative and why they're excited about it. So that's the plan for today. I am going to be switching back and forth screens a little bit, but I think it's all going to go smoothly. So I thought I would start just with a little bit of the how do we get there piece, as I said. So I received my PhD in public health sciences with a specialization in epidemiology from the Department of Public Health Sciences at Queen's in 2019. From there, I immediately started my postdoc fellowship with Dr. Heather Stewart, who you'll all know, between 2020 and 2021. In October of last year, I accepted my current position as research scientist with HSPRI. Over the last 10 years, my program of research has really focused on post-secondary student stress, mental health, and well-being with an emphasis on improving measurement. So that's really where I focused on measurement and psychometrics, as well as you sort of with an air to look at the evaluation of sources of student stress, ultimately hoping to help with the improved tailoring of upstream mental health services like mental health promotion and mental illness prevention. My areas of research expertise, while primarily psychiatric epidemiology and mental health surveillance, span mixed methods research, measurement improvement, and psychometrics, as I mentioned, program eval, and knowledge translation and exchange. So, for my dissertation during my doctorate, I developed the Post-Secondary Student Stressors Index, or the PSSI. And so this is a tool specifically designed to evaluate the sources of student stress, again, with an eye to improving the tailoring of currently offered upstream campus mental health services in Canada. The tool evaluates 46 stressors across 5 domains of stress, which include academics, learning environment, campus culture, interpersonal, and personal. And each stressor is evaluated by the respondent. It's offered through online survey, evaluated by both severity and frequency. And this is where I first explored the use of what I call a for students by students lens in terms of development and evaluation. And that's really carried me through my work since. So instead of me going to the literature, sitting at my desk and sort of estimating what I think might belong on a tool like this, we went directly to students right from the get-go. So students carried this project through from the development of the initial item pool, the refinement of the tool, all the way through to the pilot test that was conducted at Queen's in 2019 and provided me with that preliminary psychometric information. My experience using that lens has been very rewarding, working directly with the sort of end user, or in this case, the people who I hope that the tool will ultimately benefit in the long run. The second thing that I've really noticed using this lens and this approach is that I've never ever had issues with participation. I've had excellent rates of participation. I've never had any issues with needing more people to participate. And in fact, there have been circumstances where I've provided an incentive. So for example, you know, a gift card as a thanks for participating in a focus group. And I have to remind them about the incentive when they get there. They're there to participate. They're not really there for the incentive. And it's always like a happy, oh yeah, I forgot about that. So I found that students have been very eager to participate in research components that I've done when they learn that it's not being done, you know, to them, but with them and for them. So that's important. We'll come back to that. So since this project, then I've had countless students really hear about the PSSI and the approach that was taken in putting it together. And I hear all the time them saying that they've never seen research like done for us. And so I'll come back to that too a little bit, because that's really what has led to the development of the network. So as I mentioned with students, we did pilot test this tool to get some preliminary validation work done, and the psychometrics were good, but that sample, because of the time and scope restraints associated with my doctorate, that sample came from Queen's students. So from there, I wanted to carry forward and test the utility of the tool among broader, more diverse samples of students, because I wanted to know if it was going to be truly useful outside of the context of Queen's, outside of the context of Ontario, and so on. So for my postdoc, I launched a multi-site release of the PSSI across 15 post-secondary institutions in Canada during the 2020-2021 academic year. I was successful in recruiting a minimum of one post-secondary institution at every province, with the one exception of Quebec, in addition to one Northern Territory. And the results of this study showed the psychometrics for the tool continue to be strong, demonstrating its utility across the country, which was excellent. That's what I had hoped. Now, this academic year was the first complete academic year to take place during the pandemic, which of course is not something that I had foreseen as being the ultimate setting of this study. And as everything got thrown online and went remote, including universities and method of learning delivery, the pandemic really got me thinking about what upstream mental health promotion and mental illness prevention might look like in that context, or at the time in this context. And whether there was anything that I could do on my end with the resources that I had at my disposal to facilitate or provide support to students during that time, and then of course moving forward as well. Of the stressors that we observed to be the most severe and frequent, which you can see in the red box here, some were academic and might be well targeted by policy changes at the institutional level. So things like having very heavily weighted final exams or having back-to-back exams, so really sort of bunched up exam schedules. However, there were other things that I thought might be addressed by online resources and improved education, things that didn't have, like a physical or a high level administrative component to them. And then I thought there are actually a lot of things out there that would be helpful that already exist. So this is the same graph, just distributed by domain, so you can see a little bit more clearly. There are toolkits that exist that target things like improving time management, that look at things like managing test anxiety. There are resources that exist to help people be introduced to financial management. There are toolkits and guides and courses and this and that. So maybe the problem then, I thought, was that the resources were all in different places. Very little, especially on the internet, is centrally located. And this is a challenge that we've seen at the downstream level with treatment services as well, at a lot of campuses, particularly those that are very sprawling campuses, where they have services offered in various buildings and students don't really know where to go, or they go to the wrong one, and then that presents a large barrier to seeking help and things like that. We're very fortunate at Queen's now to have Mitchell Hall, where everything is very centrally located, and so all students really need to know is, oh, I go to Mitchell Hall for health services related information, but not all campuses have that. So in the same manner, there are a lot of really great upstream resources in the places of mental health promotion and mental illness prevention, but they aren't centrally located. So given the pandemic, this idea of a one-stop shop, an online space with where all of these resources could sort of come together and sit together and be that one place students would just know that they could go to locate something they might need, that idea sort of began to take shape for me. So I reached out to the students who've worked with me in the past, either, everything from TAs to research assistants that have come through Dr. Stewart's lab over the years when I've also worked with them, students who are currently working with me, as well as those who had reached out even just via email looking for volunteer work or looking for ways to get involved. And I ran, shockingly, a large Zoom conference with them. And I basically pitched this idea to them and said, is this a good idea? Is this something that you would find useful? Do you think your peers would find it useful? Is it something you would have found useful 3 years ago when you were an undergraduate student or a first-year student or whatever? And it was very unanimously supported as something that we need. And so that's all she wrote. That's kind of how we really got going. So Canada's Student Mental Health Network, or we call it the Network, is a one-stop online shop for student mental health resources. Content for the space is either created or curated exclusively by students, again, using that for students by students lens, with network created content reviewed and approved by subject matter experts, mental health researchers, and where appropriate, medical practitioners. And those experts are collected from my own sort of professional contacts that I've been able to gain over my 10-year career so far. So I have friends that are family physicians, and once you have one friend, you just sort of start to collect them, at least in my experience. So I'm very fortunate to have a network there that I can draw on for anything medically relevant that we want to make sure is appropriate and valid and safe to communicate. And on the side of subject matter experts, mental health researchers and practitioners, I've been very happy to make connections with some staff at Queen's Student Wellness Center, as well as, of course, other faculty members and people doing research in these areas. So this space centers around 3 main pillars that you see here: learn, connect, and access. Again, these 3 pillars were selected and approved by students. So everything you see on the space is something that was discussed and approved by students. These 3 pillars are based on previous research as well as my own experience, which has highlighted these as 3 main areas that are key predictors of students' mental health and well-being. So the learn pillar aims to really target improved mental health education. The connect pillar seeks to sort of help students foster strong and healthy social support networks. And then the access piece is all about positive and appropriate help-seeking behavior. So an incredible group of about 15 to 20 students and I have been working on putting the pieces of this together over the course of the last about a year now. And we're hoping to publicly launch the website shortly, hopefully before April. So this talk is very nice and timely for us. And our hope is that these 3 components of the space, as well as the space itself, again, having everything being centrally located and tailored specifically to the Canadian post-secondary population, will lead to improvements in each of these areas, as well as sort of overall well-being. And yes, to that end, we do have an evaluation framework in place. I am, after all, a Heather Stewart disciple, so I can show you that later as well as we walk through the space. So now I'm going to switch over and take you on a little walkthrough of the website to show you what we've been working on for the past year, and then I will pass it over to the students to discuss a little bit further. Just bear with me here as I switch out. And then we'll take questions, of course. All right. So this is what it looks like at the moment. You can see our 3 main pillars along at the top here. The first thing I just wanted to show briefly is all of the amazing students that have been putting in unpaid time and effort alongside a pandemic and all of the other work and changes that they're going through. It's really been such a group effort and they're so amazing. So I wanted to brag about them. In our Learn section of the website, we have 3 main components at the moment. The first is a mental health module series that we've created. So this would be content created for and by the network. So the idea with these is to offer sort of mini courses almost. We've put them together using, I'm not sure if software is the correct word, but a tool called Articulate 360, which is offered through Queen's University. And I will just walk really briefly through part of the first one, but you can see they're put together in a very sort of professional manner, which is great. It makes me look like I'm a programmer and I'm absolutely not. So all of the content here is collected by students and then it goes through a revisions process. So there's, we have students assigned to each pillar who are interested in working in each section. So students that are interested in working in the Learn pillar sort of raise their hands for a particular topic of interest that they think would be useful to have as a student. They go out, they collect all of this information, they provide citations, they provide ideas for the formatting and things like that. Then it goes back to the broader network. So then it goes to all 15, 20, 25 students that we have working for us for an initial review of content. When they're done, changes are made, and then it comes to me for a review. And after that, it would go to the subject matter expert or experts that are assigned to that module. And then of course it would go into development, as you see here, and then finally released. They're quite time consuming to create. So we currently have 2 done and I think 4 in development. And you can see on the site here, you know, many ideas for topics. There's also a space for students who are visiting the website to tell us that they'd like to see something that's not there. They can also, of course, reach out if they're interested in being involved in the content creation. So that is built in as well. And that, I think, is really the first thing that I thought about when I was dreaming this up in my head, was because of the nature of my job and being a faculty member, I thought about education first, and then it sort of blossomed from there. The second piece that we have in the Learn section is to go sort of one step beyond the modules, is the provision of online courses. And I didn't want to make the network too much about creating our own content because there's already so much out there that's so fantastic. And so what I really wanted to do was leverage that rather than trying to reinvent the wheel. I think over the course of my career thus far, one barrier that has routinely emerged is the tendency to want to silo. And you know, that's great, but I bet I can do it better. But there's a lot of stuff out there that's already really great. And I think it's really important to bring it together. One thing that's really interesting that comes up all the time in conversation with the students is when they come up with an idea and then they try to decide which pillar it belongs in. And we often have conversations around, well, maybe that it seems like Learn because it's education, but I think that's kind of Connect too, because it's a bit about making connections. So where do we put it? Because it crosses the borders. And I love when that happens because these 3 things should intersect. They aren't individual siloed components. In the mental health courses area, I've also tried to work towards removing as many barriers as possible, and that includes financial barriers. So we know that there are a lot of universities that are now offering an intro level mental health course or resilience course or things like that. Coursera offers courses like these for free from, you know, well-known institutions, obviously the University of Toronto and Yale and Rice, Penn, University of Sydney. So these are from all over the world. They're free to take. If you want to get an official certificate from them, you can pay a small fee, but the actual content of them is offered for free. This is, of course, a non-exhaustive list, but just sort of intended to give students an idea of what they could find on Coursera, and they're all linked accordingly. We've also included a section for mental health training or workshops. This is another thing that's often offered at post-secondary institutions to students for free, but students don't really know that that's an option. So we've included links out to, for example, mental health first aid, which is offered across the country in, you know, many communities across the country. You can sign up, again, working towards those sort of eliminating financial barriers as much as we can. These workshops are available, but they are associated with the fee, and they range. So it ranges depending on the facilitator. You can pay as little as $50, you can pay as much as $200, depending on where you want to take the course. We wanted to make sure students knew that a lot of institutions do offer these to students for free. And so to that end, we have some text indicating that here, as well as a contact sheet that we've compiled that has the website link for every student wellness center at every currently university. It will have colleges as well across the country. It's all linked. They can click, find their school. And of course, these are websites they could easily find on their own. But again, in the interest of having everything centrally located, we have that provided there for them. The final piece so far in the Learn section is our curated TED Talk library. So this includes 2 main categories. One is stories of lived experience, and the second is includes presentations that are more educational in nature, so more like learning about mental health and mental illness rather than learning about you know, the fact that you can live with a well-managed mental illness and have very good mental health, which is a concept that a lot of people are unfamiliar with. In our Connect section, we have 3 main components as well. One is not posted yet because it has just developed in my brain over the last couple of weeks, so it still exists. It's currently under development. The first thing that we have is a pure connection section. And again, in the sort of keeping in mind that this was created during the height of the pandemic when everything was online and there was no physical thing in sight for a while. We aim to compile this list of essentially online forums that are designed to foster connection and create a safe space where people can share their stories, share their thoughts and feelings with other people, other like-minded people. Together All and 7 Cups are sort of for general population, and then we've also, and Wellness Together Canada, and we've also included some that are for more specific populations like the Indigenous community as well as the LGBTQ community. When we sort of initially talked about what we wanted to see, when I say we, I mean the students and I, what they wanted to see in their connection section, we talked initially about whether the network could be a space like this, where it could be an online forum for these discussions. And the reason that we went away from that is, again, that conversation about these things that are being done really, really well, that are already out there. And I think Together All in particular is a very good example of that. The second thing I wanted to avoid, I wanted to mitigate risk associated with anybody expressing suicidal thoughts or behaviors or indicating self-injury or anything like that, even indicating tendencies towards those things. Together All actually has all of that built into it already. It's moderated 24/7 by trained mental health professionals. They have written into their code trigger words, so if certain words are used, they're picked up, and that person who posted is immediately linked, or whatever within a particular time period is linked with a professional. So that risk mitigation that is a safety concern for students that might be using these things is already there. And that is not a capacity that I have on my end. So we stuck with linking out to things that are already doing these pieces really, really well. The second thing that we have in the Connect section is a clubs portal. The purpose of this is to bring together every single university so far. Again, it will have colleges as well, but we need to start somewhere. Every single club portal or directory that exists at a university across the country. So you can see here, for example, if a student went to Queen's University, all they need to do is click here and it takes them to the clubs directory. They can find 1,100,000 clubs that exist at Queen's that they could take part in. Again, just keeping everything very centrally located. The third thing in our Connect section is our network podcast. This isn't launched yet. Breanna can talk a little bit more about this today. I was delighted to send Breanna to a podcast development course recently, which she completed. And so we have great resources and a great foundation to start putting this together, and have sort of set ourselves up for success in that way. So we're currently outlining what that's going to look like and who our first few guests will be. We're envisioning that as being a space where we could have subject matter experts come in and speak about their research or whatever their area is in mental health related to the student context. We can also have students come on and share their lived experience stories with positive recovery messages and things like that. So we're looking forward to putting that together. The final thing that we will fit into this section that, as I mentioned, doesn't have a picture yet, doesn't exist yet, is the development of some sort of a mini course similar to the modules that will be aiming at developing and maintaining connections and relationships at university. So this is, again, something I brought to the broader student group and said, is this a dumb idea? Or is this something that you think would actually be useful? And again, everyone said, oh, that would be great. I wish I had that in first year. Something as simple as a guideline for where you can meet people, how you make friends, how you make connections at university that's suitable for both, extroverts and introverts, and different options that they can take to meet people. Of course, joining clubs being one of those things. So again, tying everything in the section together, tying everything in the network together. We also thought to include a section in that connection toolkit that would talk about toxic relationships, as well as not only how to make relationships, but also how to maintain them, how to navigate changing relationships with your parents as you enter emerging adulthood and some of those strings start to kind of come loose. So that's something that is in development so far, and was something that after a thorough search, we really couldn't find anything that already existed. There were a few, I came across some blog posts and things like that, but there was nothing that was a toolkit for relationship development. And so whenever that happens, we sort of seek to fill that gap as best we can. In our access section, this of course is about help seeking and also appropriate levels of help seeking. So the first thing we have is probably what you would expect, our resources bank. This again includes that student wellness services contact sheet for every university across Canada, which you already saw. It also includes a mental health resource bank, and this is again broken down by things that are nationwide, things that are province specific, and then things that are specific for particular student groups, like we mentioned before, the Indigenous community, the LGBTQ community, etc. And these would be sort of broader community resources that are available as well. So this piece is more about not us providing help to students or directing them to help, but making sure that their awareness of what's out there is improved. And to that end, our second piece is a mental health app library, so not dissimilar to the connection forums piece. This is of course not exhaustive either, but what we have here is a breakdown by mental illness or mental health struggle that shows some recommended apps. They've got the links out to either the App Store or the Google Play Store. The other two things that we've incorporated in this section, which is not complete yet, but I thought I'd show you anyway, is we'll have an Instagram style check mark to indicate that an app is evidence-based, meaning that it has some RCT evidence associated with its efficacy. And we'll also have some sort of a tag for physician endorsement. So for example, I know that MindBeacon, Ability, CBT, and BetterHelp are all recommended by physicians. So that will be indicated as well to sort of help them make an informed decision. We have a lot of language up here and citations around the sort of evidence for apps, as well as the sort of emergence of operating platforms that can help them to make a more informed decision. Indicating too that just because an app has published evidence doesn't mean that it's necessarily, take it with a grain of salt sort of idea, but also just because it doesn't have a published RCT associated with it, don't throw it in the garbage either. I think those are two really important pieces. RCTs are very expensive and it's really easy to create an app. So you sort of have to balance those things when you're making those sort of considerations. But this was one of the first things that the students pointed out as being useful. Obviously, as I said, this is non-exhaustive. There are a ridiculous amount of apps out there for everything, and as well, they're also for mental health, but this is a nice place for them to start. The last piece in this section that's not currently completed but is under development and might actually kill me is the development of the campus services map. This is a GIS-enabled location map that shows every university across the country, as well as so you can select your university, it zooms in on your campus and shows all of the health services resources available on campuses for students. It shows their location, their contact information, when they're open, when they're closed, their website, all of those things. Again, centrally locating things so students don't have to scour the websites and figure out where they're going or where they're supposed to be. Of course, this is, as we've said, easier on campuses like Queen's where we have things centrally located, but I think that's something that will be very useful for students who do find themselves on a brand new sprawling campus, maybe in a different city, to easily locate those things. The final section that we have is just a brief getting involved with research piece. So these are some things that have been that are sort of underway in my own lab, and the one that I want to show you is the evaluation of the network, which I mentioned before. So this is the logic model that we've created for it. You can see each of our three main pillars there that will hopefully and eventually lead to these outcomes of interest. So improved mental health education, improved social support networks, and improved awareness of mental health resources. We do, of course, know that the lifespan of an initiative or a project is directly related to the type of evaluation that you're able to do. So I don't expect to be able to do an outcome evaluation anytime soon. Few students of mine are currently putting together an outline or a framework for a comprehensive evaluation that will include the formative piece. So we'll look at a process evaluation initially, looking at things like Google Analytics for clicks and visits and where people are located from, getting that kind of more qualitative feedback from people as well. I actually forgot to show you at the end of each, actually it's still open so I can show you. At the end of each module, we've been able to directly embed a feedback survey, so they don't even need to click out to go anywhere else. It's right there. I'm really hoping that's just going to make them respond to it and hit submit, so we can get some qualitative feedback back on it. That allows them to tell us whether they learned something or whether it reinforced what they already knew, whether there's something else that they would like to see, whether we missed something, whether there was a broken link, anything like that. So we can garner sort of as much student input back as possible. And the evaluation will also be ongoing. So my thinking is sort of process evaluation within the first 6 months of launch. And then at the 1 year point, we can look and see if we think we might have enough there, have been around long enough to look at whether some outcomes have changed. The challenge with that, of course, is that it'll likely be done with online survey. And I thought about different methods of getting, garnering participation, but I'm sure everybody on the call has been on the StatsCan website where you click around for a while and then you get a pop-up that says, tell us how we did today, do you like the website? And I thought about that approach, but one thing that's challenging in this context is that they need to have spent some time here in order to give us an idea of whether that's had an impact on outcomes. So I would rather have them come to this page, for example, of their own accord and say, yes, now I'd like to give you some feedback on how this has helped me over the last 6 months or over the last year and what have you. So that's what we're sort of thinking. Again, that's still in development, but yeah, that's where we are at. So I will now happily turn it over to the students to chat a little bit about, they'll tell you who they are and what they've done in terms of the network and why they're here, why they're working on it. So Maddie, you're at the top of my list, so I'll ask you to go first if that's okay.
Yeah, sure, thanks. Hi everyone, my name is Maddie. I am a first-year PhD student at the University of Toronto. I obtained my Master's of Science from Queen's. That's where I met Brooke. I've actually been TAing with her for about 2 years now. And I obtained my Master's in Translational Medicine just this past August. And then now I'm at U of T pursuing a PhD in Health Services Research. And my research will focus on evaluating access and utilization of mental health resources by youth and young adults as they transition from child to adult care. So I primarily work on the learn pillar with the website, and I'm actually working on a pillar or a module focusing on graduate student mental health and the resources around there. Obviously, I've been a grad student for 3 years now. I've been a student for basically my entire life, so it's kind of a topic I was really interested in exploring. And I particularly want to look at, providing resources and information for people entering grad school on, isolation that you could feel or loneliness, and then also including some information on imposter syndrome, because I know it's pretty rampant in this field. So that's something I'm working on. I'd also like to create a module eventually on focusing on mental health during large life transitions. So whether that's going from to university or, a death in the family or just any sort of transition like that, but focusing on getting the graduate student mental health one done first. I think this website is really great just for many reasons, but primarily because it's a really comprehensive, guide and spot for students to access. Like in my personal experience, I find it a really interesting contrast between not feeling like there's enough information out there, or maybe that's a factor of not knowing where to go. But then also if you do a quick Google search, it can be very overwhelming and on what's available and not knowing what to trust. So I think this website does a really good job of kind of addressing both of those issues that I've personally found. And I think if anything, it can initiate a conversation, with the student with themselves about, maybe they need to learn more for themselves or a family member, or just to understand more about mental health in general. So I think it does a great job doing that. And then I know Brooke talked about the difficulty in her map of campus resources, but I do think that's a really, really great resource for students to have so they know where to go. So it's been an honor to be a part of this project so far, and I'm really looking forward to continuing on it.
Thanks, Maddie. Anjana?
Hi, everyone. My name is Anjana. I'm a second-year health science student at Queen's University. So I had the privilege of taking Dr. Linden's course actually during the beginning of the year, and I immediately reached out to her because of the amazing research that she was doing in regards to post-secondary student stress. I'm involved with the JAC.org Queen's chapter as the intersectionality director, so I was very excited to create the intersectionality and mental health module in the Learn pillar, and I think that was an important facet to explore because it allows you to understand how different communities and marginalized communities are impacted by mental health differently. And I think this tool is absolutely incredible because I think it allows students to be able to find all the information that they need in regards to mental health advocacy if they'd like to connect with other people, but also in regards to resources that they can access. And understanding like how during my first year, I did it completely online. So especially during this transition, it's been very different because I don't know a lot of the health services that are available on campus. So having a campus services map would be very important. And I think that transition has been extremely difficult for a lot of people during this pandemic, because first years, second years, and third years right now have had this awkward period in their university life where they have this disconnect between the resources that they're aware of and the resources online. So this allows students to be able to access everything easily online and learn more about how they themselves can get involved. So I think that's why I'm really excited to be a part of this project.
Thanks, Anjana. Breanna.
Hi, my name is Breanna Plater. I use she, her pronouns, and I'm in the third year of the Bachelor of Health Sciences program at Queen's University. So far, I've helped with the Learn and Connect pillars. I've helped with the development of the TED Talk library. I'm actually on TEDx Queen's U as well, so that was something that I'm familiar with anyways. And then, as Brooke mentioned, I was fortunate enough to attend the podcast development course that just finished up about 2 weeks ago now. So we're going to be talking more about how we want to format it, type of guests we want and everything. And that was something I was really interested in because with my own experiences with mental health, sometimes you can feel like you're really alone, but being able to hear the lived experiences of others on a dedicated podcast could be very helpful for some, especially post-secondary students, where there is a stigma around talking about your mental health. So yeah, I'm really excited to see where the network goes and for launch and everything.
Sorry. Amy, on the edge of death and still here. Thank you so much, Amy. Amy has a terrible cold and still agreed to come. So
Yes, my apologies if I break out in a cough in the middle of speaking here. Except I'm just really excited to be able to talk about this thing that I've been working on so hard for the past year with Brooke and everyone. And it's just, yeah, so great to be a part of. I also took the course that Brooke took last year when I was in second year. I'm a third year health science student now and absolutely loved the course. And when I found out she was working on a research project in mental health is pretty much all I knew about it when I signed up, and I knew that's something I wanted to be a part of. And since then, I've become one of her research assistants. So I've been doing a lot of work kind of managing all sorts of little aspects of the network, to be honest. I've recently worked a bit on one of the modules on stigma, which is really great, especially since I'm so interested in Heather Stewart's research on stigma as well. So that was really interesting to be a part of putting together. I'm also working, as Brooke mentioned, putting together kind of that framework development paper on the evaluation of the network, which is really great. And it's been really interesting to write with two other students who weren't able to be here today, but they're helping me out with that, which is amazing. And I've learned so much so fast about just like the areas of research available in mental health. And this project is especially important to me because it's something that I would have absolutely loved when I was a first year coming in and not knowing what was going on. I remember calling Student Wellness Services saying, honestly, I can't figure out your website. Can somebody just tell me where to go? And that kind of is the idea that this website is trying to fix. And I think that's so great. And I'm so happy to be a part of it. Sorry, my voice is dying here. I'll let Brooke take back over.
I'm just going to jump in. Before we sort of open it up, I just want to say thank you so much, Brooke and Maddie and Anjana and Breanna and Amy. Honestly, as every click you went on, Brooke, I was like, wow, you really have compiled everything that one could ever imagine. And just wanted to say congratulations. And I'm just picking up a few things in the chat as well. I see Jen Fleming has asked a little bit about addictions, if there's anything on addictions. And I think I briefly saw something about drinking in one of the modules. Just wanted to ask about that.
Yeah, we definitely conceptualize substance use disorders as being under the umbrella of mental health, absolutely. We will be putting together an addiction-specific module in the Learn section. There's also a tool that was developed by Queen's Student Wellness Services. I don't know if it was specifically the health promotion team, but my colleague Kate Humphreys, who I'm not sure if she's here or not, but she was involved in the development of this really excellent, I don't know how to describe it, almost like a self-rating tool where you can fill out you fill out this tool and it tells you essentially what color you're at. So whether green being red, or sorry, green being good, red being bad, gives you an idea of where you are along that continuum, and then links you out to resources as well. So those are things that we're going to include in the access section. I'm hoping to take my tool, the PSSI, and develop something similar as a student-facing version of it that can then identify, here are your most severe sources of stress, and here are resources that directly connect to that might be helpful. So yeah, we want to leverage, like I said, those things that are already out there, and resources related to addictions and substance use are definitely those included.
Great, thanks so much. I'm a liver doctor, so I see a lot of consequences of addictions, and so I always try and give the medical students resources when I'm teaching about liver disease related to different substances. So once this launches, I'll certainly be directing them towards that, and I'll peruse it myself to see if I can even send it to patients who I see and things like that. So thanks.
That's great, thanks. And resources as well, like the core will be, there are a few universities that have resources similar to the core. I believe McMaster has something similar as well. Those are things that they'll be able to find on the campus resources map too. I think the plan is to sort of initially start with the mental health specific resources being mapped, and then add a filter for like physical health services as well. And then any student-led initiatives on campus as well that have a physical location will eventually be included too.
That's great, Brooke. I'm just pulling things from the chat. I know Joan had to leave, and I was also noticing this. Did a great job presenting your findings and I thought it was remarkable. That was a 3-time series of surveys you deployed, and you retained a remarkable time 3 sample.
I'm telling you, I've never had problems with participation.
Remarkable. And
I will say that those were, so yes, the study design was, we did 3 time points over the course of the academic year in October, January, and end of March, with an attempt to sort of see if we could do some longitudinal analysis. And the actual initial plan was to look at whether we saw fluctuations in certain stressors over the course of the year. But we didn't. Spoiler, that paper's not out yet, but nothing was significantly different in terms of mean severity over time. However, it was also the pandemic, and the pandemic in Canada really began in full force in about March 2020. So by the time everybody was going back to school in October, it really looked like, with the validation measures that we had, like the perceived stress scale and the Kessler 10, that stress and distress just started here in September, and they just stayed there. So nothing moved. Anything that was stressful at the beginning just remained as stressful as time went on. We also didn't see any changes by region either, which was something that I wanted to look at, because if things were vastly different in Atlantic Canada compared to Western Canada, then it might indicate needing versions of the tool, but that wasn't indicated either. We were very lucky to retain as many as we did. I will say they weren't linked, so it's not necessarily like the same 4,000 respondents that did T2 and T3, but we did have, I think, over 4,000 at each time point. It was a total of about 12,000 altogether with all 3 samples combined, and some of them were linked. So we did have that built in. If a student did complete 2 or more of the surveys, we are able to watch them over time, but it was a substantially smaller sample.
And I'm just going to pick up with Joan had asked, and I was intrigued here because I really loved how you presented each of the different domains and started to talk about how you might leverage different interventions for different ones. And she's talking about the stress associated with academic expectation and demands, because that caught my eye, that almost all of that was with a heavy weighting. And just, her question is, how do we better prepare students for these types of demands? Because those are hard to, you talked about some policy changes around exams, because I noted exams was a big issue.
Yes, heavily weighted exams and having multiple exams, particularly back to back, have been in every sample, every test sample, every study that we've done, have been top 1 and 2 every single time. Those, I think, are definitely policy changes. I think even during COVID, at least in my experience, we had a lot of communications from the department and even the faculty saying, if you can avoid doing a final exam as an assessment in your course, maybe consider an essay or something different. And that messaging was coming because the use of online proctoring is so expensive. And so when everything went online, it was a significant increase in expense for online proctoring where that wasn't being used previously. But I think, and I hope that will maybe nudge some instructors towards using different assessment methods. I've never really thought that tests are the greatest way to learn or evaluate knowledge. And I do say that as a hypocrite, because I do have a final exam in my course, but I do think it's important to move towards different types of assessments that might do a better job of evaluating learning overall. But I also think that that's a very large scale structural change. You know, Heather and I have this conversation all the time. Heather, I know you're on the line, about how, you know, we largely feel that grades shouldn't exist because, you know, you think about medical school as pass and fail, and yet undergrad students are killing themselves to get a 96 instead of a 91. And those are the students that I hear from. I get students with 90s asking for 95s. I don't get students with 70s asking for 80s. So there's another layer to that, and that's the performance anxiety piece. And those are actually the more campus culture pieces that we saw in the separated graphs. So things like, I'm not working hard enough, my peers are smarter than I am, comparing myself to others, pressure to succeed. These students come into university with A+ averages from high school, and all of a sudden everybody has an A+ average. So the competition shoots up, and it's largely the expectations they place on themselves and less so the expectations that we place on them. I think often, at least in the program that I teach in, profs are continually shocked by their averages being so high. But the students are performing well, and yet they still feel that they should be performing better. So I think resources like the one that Maddie spoke about with speaking on imposter syndrome and you know, mediating things like test anxiety, we have to kind of tease apart what's happening there, because it's not necessarily what do we need to do. It's more what tools and resources and skills should students have even before they hit university. And that's an area where I'm hoping to take my program of research, and that's addressing the sort of two transition periods that we have, end capping your post-secondary education. So the transition from adolescence or high school into the post-secondary setting, and then your transition from post-secondary into the workforce. And those are two transitions that I think really deserve some attention. We're definitely hearing increasingly that there is a call for more work to be done in this area earlier and earlier, because it's all about getting ahead of it, right? The same reason that my research focuses on bolstering upstream services to alleviate the bottleneck that we're seeing at downstream right now, where all the students are standing in the same figurative line waiting for counseling, but not everybody in that line needs that level of intervention. There are other things that they can be turning to, but they don't know that, or they don't care to know it at this point. So we need to think about how do we mobilize that knowledge and ensure that that awareness is there. So I think that that's where the work should be. Not to say that treatment is not important. Treatment is extremely important, but there will never be enough money to throw at treatment to alleviate the bottleneck.
Yeah, no, those are great points. You know, I love the idea of like thinking like policy level, but also sort of that individual student perspective. Kathleen has put something, I don't know, Kathleen, if you want to ask it, or I'm happy to, just talking about websites and keeping websites updated. And because I mean, what you've done, I'm just in awe as you kept clicking and further and further. And I love the fact that you were bringing together already proven resources, because, you know, working with older adults, there's so many things that we look at in our older adult world that are already done. And how do you bring things together? And how do you maintain all of this?
Yeah, I'm really glad you asked that question, because it's something that I discussed with my colleague in health promotion when we were chatting recently. And that was the first thing that she said is, that she recommended was, as much as you can, stay away from it being, you know, your responsibility to update content. And so wherever it sort of reinforced that idea, wherever we can link out to things, we're not responsible. We're responsible for whether or not that link works when they click on it, but not what's at that link, if that makes sense. So the plan currently is to do I'm not sure about timing yet. We'll have to see once it launches, and we'll get an idea of how quickly links can change and things like that. But part of one of the volunteer jobs will be to review the links and click through and make sure that everything's working. We also have that piece built into one of our contact options, is that there's a broken link or something's not working or a picture looks weird, whatever. So we have pieces built in to help us maintain that updating. I will say that everything done to date has been done with zero funding. And so currently it's been very cost effective. And moving forward, were I to secure funding, there might be a space to have a dedicated research assistant where one of their roles is to do exactly that and maintain the links as much as possible. But the things that we'll be directly responsible for updating will be the things that we've created. So our module content, which largely all the links in the module content link out to academic resources published in academic journals. So those DOIs, I believe DOIs intentionally are unchanging, so that shouldn't be an issue. The modules are controlled by us through my Articulate 360 account, so unless I go somewhere, those should be fairly safe. The GIS map might be a bit of a challenge because there'll just be a lot of pieces in that will need to be checked, including buildings and contact information. So we may have to scale back on that if we find that that's something that we're routinely updating over and over and over, where we just link out to whatever the website is. And then again, the information is updated by the owner of that website rather than myself and my students.
Kathleen, I don't know if, I mean, that is impressive, meticulous thinking. I don't know, Kathleen, if you had any other thoughts.
No, it's just, figuring out how to have other people do the work for you, like report broken links, because your approach is great to rely on externals, but the key is the links have to work. Otherwise, the people are having to search it for themselves. So great, thanks.
Yeah, no, there's another question. I don't know if Cynthia's still here, if she wants to ask it.
Hi, Cynthia.
Hello, thanks, Brooke. That was a great presentation, and to all the students, thank you for your input. That's wonderful. I did post a question. I just wondered about efficacy from the student's perspective when they find their resource and or use the resource that you've posted. Will you be doing any follow-up as far as, are they getting what they need from the services that students have access to?
Yeah, that's really interesting. So I think, that's the general idea behind the evaluation framework for the space. But as I mentioned, some of the challenges with that include, they have to have spent some time on the website looking through the resources and accessing them and using them in order to, fill out a survey and let us know if it was helpful, or even for them to detect whether or not it was helpful for them. We do have some things built in. So as I mentioned, at the end of any module that they complete, there's a feedback survey so they can let us know if they learned anything, if it reinforced their knowledge, if there's something we missed, things like that. If there's something else that they think that we should add, which we can always do. We're not providing resources. We're trying to sort of increase awareness, if that makes sense. So with the exception of the substance abuse tool that I mentioned that SWS has created, as well as the student-facing version of my tool, those are things that, again, we can build in that sort of once you've used this feedback survey. But for most of the things, I think it will come down to that overall survey that looks at the evaluation of the resource, which our initial evaluation will be all about feasibility, feasibility, efficacy, and utility.
I mean, I asked that, it's a self-serving question given running a student wellness services. We want to, whenever possible, get feedback about what we can do better, what we're not doing well, etc.
Sure.
And so, if there's any opportunity there, I would be interested in hearing about it.
We'll keep in touch, absolutely. One challenge as well is that because it's a national resource, I would absolutely love to be able to do that with every single student wellness service that exists across the institutions in Canada. But it might be hard to be that granular about it. The feedback, we could, as long as we're asking where the student attends university or college, there's the opportunity to pull a subset of data to look specifically at Queen's students, for example. But one thing I wanted to say is that I think the knowledge translation and exchange is extremely important, and that's something that I would like to build in as well. So the evaluation reports and the data that we get will not be secret. The plan will be to release technical reports that will be available on the website and that can be communicated to people like yourselves that are interested in seeing that data as well.
Okay, great. That would be wonderful. The other thing I put in there was step car model. You talked about it a little bit in the sense that, and we see this here too, students come to us and say, I need to see a psychiatrist.
Yeah.
And they only ask that because they don't know what other resources are, and they know that what a psychiatrist kind of is.
Yeah.
So how a step care kind of model can be built right into the tool. So I don't know if it's a navigation bot or something like that, so that they can put in what they're feeling and then find a resource that actually matches that versus having so many resources that they're overwhelmed by
Absolutely,
what they're seeing. So, yeah.
So one of our modules that we is on the list for the development will be help seeking and self-care. And my plan, it doesn't exist on paper yet, this is just in my head, but what I envision is almost like a sort of triage in terms of helping students to determine what level of intensity they're at and what level of care they should be seeking. And that's what I mean when I say appropriate help seeking. So it might not be appropriate if you're super stressed about exams today to see a psychiatrist. I know you guys also have a lot of students reaching out and saying, oh, the waits are so long, I have to wait a week to see somebody. And that's not really an unreasonable timeline. And so communicating those things so that students are aware of that going in, I think is really important. And working with people like yourself and other people at SWS to make sure that when we've built this sort of, it's not quite a triage because it won't ultimately direct them somewhere, but helping them to kind of interpret where they're at and what would be an appropriate level of care in terms of intensity is really important. So yes, when we get to that module, I will be reaching back out to you to make sure that you and care providers are happy with what that looks like.
Okay, great. Thank you.
You're welcome.
Thanks very much, Brooke. And I know we have 2 minutes left, but on the last little bit, just wondering your plans to reach out to the different student centers, student wellness centers, because I mean, honestly, this is so impressive for them to be able to share that, pan-Canadian.
So my pie in the sky for this is that when we launch, well, my ultimate pie in the sky is that students find it helpful. My secondary pie in the sky would be that it is picked up enough that student wellness services are happy with the content and are willing to, not the word advertise, but spread the word that it exists and suggest it be a resource that students can reach out to. That's what I would really, really love to see. We've got, ideas as well for future developments that we can do as well, which include things like online conferences that are specifically for students. And we've got some ideas. Some of those ideas might require funding in the moving forward, but we are hoping that this will be launched by April 1st at the latest. And I'm hoping it sort of spreads like wildfire. And I have been also fortunate enough to make some connections with student wellness centers at some universities, particularly the 15 institutions that participated in my multi-site study. Some of the co-investigators that I had at those institutions, like at Memorial University of Newfoundland and Labrador, were actually directors of student wellness centers. So I have some connections to start with. One thing that I want to be very cognizant of is not reaching out to student wellness centers and having them feel as though I'm putting something else on their plate. Pay attention to me because I know that they have a lot going on. So the hope is really that I can sort of spread the word about it without being annoying, for lack of a better word. And yeah, I'm happy to build those partnerships wherever they're available.
Well, thank you so much, Brooke, for sharing this. It's really impressive. If anyone here in the room could help, spread the word, we'd be thrilled. Just to let everyone know, Dr. Joan Almost is doing April's talk and looking at nursing workforce challenges. So, Brooke, thanks. And thank you, Maddie, Anjana, Breanna, and Amy. Honestly, I kept saying, wow, all over my notes. So thank you so much for this. Have a great rest of the day.
Thanks
That
very
was
much.
great. Thank you.
Bye.